Good day, everyone. I am Christine, the moderator for this webinar. I welcome everyone to today's webinar, Grievance and Complaints Ensuring Compliance with the CMS and OCR Requirements in 2025. I would like to introduce our presenter for today, Laura A. Dixon. Laura A. Dixon, PS, JD, RN, CBHRM, recently served as the Regional Director of Risk Management and Patient Safety for Kaiser Permanente, Colorado. Ms. Dixon has more than 20 years of clinical experience in acute care facilities, including critical care, coronary care, perioperative services, and pain management. I would now like to hand over the floor to the speaker. Over to you, Laura.
Hey, thank you very much, Christine, and welcome everyone. We're talking about an issue that unfortunately hospitals have to deal with. And I mean unfortunately because it involves where the patient, their family, representative, whoever it is, wasn't totally satisfied or were downright upset with the care or something that happened within the hospital. And so CMS recognizes that this is an opportunity perhaps for us as the healthcare providers that maybe we can learn from that. And we do need to follow up with the patient and others when we didn't meet their expectations so that we can continue with that collaborative healthcare environment and care in general. Speaking briefly about some deficiencies, here's just a few examples on complaints and grievances. They didn't ensure prompt resolution. Let's go ahead and start with the grievances. They're in the patient rights section within Appendix A. And I've got the tag numbers there, A0118200123. Now, all acute hospitals that participate in Medicare and Medicaid have to follow these rules. Now, one thing here is different, and that's critical access hospitals. On notice of rights, you have to tell each patient of what those rights are in advance of giving or discontinuing care on the notice and when this person has the patient representative. Not every patient would. Well, what if they are incapacitated? And that could be for a variety of reasons. By the way, spouse also includes same-sex marriages. Other state laws, yes, you have to follow them. Medicare beneficiaries, the IM notice, which stands for nothing more than an important message from Medicare. That's all that stands for. Moving back to the conditions of participation. The next tag number, this is the big one. This is the process. You have to develop and have a process so that you can really handle and address a prompt resolution of a grievance. The definition is a formal or informal written or verbal complaint. And again, if it's a minor request like my my bed hasn't been changed in days, if the patient's satisfied, but the representative, this is the representative, is not, this is the authorized representative. Again, I would still take that step to talk to the patient. Briefly on billing, they're generally not grievances unless it's a quality of care issue. If it's telephoned in, and this is after the patient's gone home, consider that a grievance. Maybe they were too uncomfortable. Even if the patient says, I want it treated as a grievance, it's always a grievance. You take care of it at the time. Man, this food is awful cold. Now we have to have a way to resolve that complaint. It has to have prompt resolution. The effective operation of that process, they have to make sure it's being done and it's working. The board has to review and make sure these things are resolved. All right, what if you get a committee, which again, you can do. It has to be more than one person. They will look to see, first off, has the governing board approved it? Timely referral is crucial. So that's what your process has to have a mechanism. So again, they handle any complaints, quality care reviews. They also will make you aware if they get a complaint. There is also a website. You might want to keep an eye on it. All right, so now patient has complained. We've told them to who complained to. Well, how long does it take us to do this review? This isn't in the actual regulation. The interpretive guidelines have that. They say a time frame of 7 days. The surveyor wants to see that time frame. You have to provide a patient written notice of your decision. And again, the written notice has to have an explanation and communicate it in a way, in a language the person can understand. Now, here's where it gets tricky on this written response. Critical access hospitals. Again, it's in the swing bed section. I'm now going to switch over to the Office of Civil Rights, Section 1557 of the Affordable Care Act. There was a lot of back and forth with this, and the patient rights section really dovetailed these provisions. They did some changes in 2020. Non-discrimination. This is really where a lot of these complaints come from, along with HIPAA. So non-discrimination. Now, you also have to make sure patients have auxiliary aids that they need. And again, that could be qualified interpreters. On 1557, you have to train your staff on what that law says. Two other laws, they do require you to have written grievance process, Title II and Title IX. So we got done way early, much sooner than I expected. So I'm going to give you a couple key takeaways. Give patients information on their rights, how they file a grievance. Don't forget their representative, especially if they're incapacitated. Tell your staff what they need to know. Who do they notify if this does happen? Keep the governing board up to date on what's going on. Make sure you've got that policy and procedure on grievance and who is responsible to respond and how. Thank you, Christine. And I want to thank everyone for attending. So thank you, Christine, and thank you to all the participants.
Thank you, Laura. That concludes the session for today. Thank you, everyone, for participating. You may all disconnect now and have a great day.